Welcome, I'm Alice Barraclough. Today my guest is the wonderful Dr. Sandeep Kapur. Today we're going to be talking about exercise. How long would you expect again for the full recovery to come back to be able to exercise at the level you were before?
Certainly at the Mayo Clinic they're looking at rehab programs,
Right.
but they are all very individualised, because for some people it may be that they want to get back to running marathons, whereas others want to be able to climb up the stairs.
Yeah.
And so tailoring programs for individuals' needs is the way forward.
Yeah.
But that again is going to require quite a lot of input, be it from patients' primary care providers to other professions allied to medicine, such as physiotherapists and occupational therapists.
Obviously, if you've been sick, usually your doctor would say, make sure you ease yourself in, don't go all guns blazing straight back to the gym and lifting all those heavy weights. But do you think there's perhaps an argument that if you are easing yourself back into exercising, you should be focusing on strength training rather than cardio, because the inactivity, your muscle mass decreases?
What we do know is that patients are experiencing multiple organ involvement. So we're finding that certainly up to 30% of patients may have cardiac involvement, so heart involvement.
Right.
So their heart muscle may be somewhat compromised. In others, it may be related to their kidney. So in 15% of patients, we're finding evidence of kidney damage. So again, the structure of the exercise program, if it's more just muscle involvement, then strengthening muscles gradually may be the way forward. But if it's heart related, then thinking about a structured cardiovascular sort of program would be more beneficial. We do need to remain vigilant until we're able to control the spread of the virus in a better way. The last count I heard, there were over 120 manufacturers trying to develop vaccines. So there is a big push for that. There are a number of barriers that need to be overcome before the vaccine is widespread and available.
Because it's better that it works properly.
And I would categorise it as 4 A's really. We need to have an accurate vaccine, i.e. a vaccine that is efficacious, that confers immunity. We're going to need to have something that's accessible, so we need to have the manufacturing in place to produce the vaccine, because as I said to you, 37 million people have been infected, but there's that's less than 10% of the population, so a large number of people are going to need to be immunised to gain that herd immunity that we want to achieve, and then it needs to be accessible. So we're going to have to work out how we're going to deliver the vaccine. Is it through primary care? Is it through pharmacies? And then it's got to be acceptable to people. So one of the concerns I have is hearing lots of patients say, well, actually, I'm not going to take the vaccine because it's been rushed into production. I'm not sure of its safety. And those are all valid concerns, but that will be at a public health level and a government level to reassure people of the safety.
Do you think that there's kind of been an increasing worry around accepting it or taking a vaccine when it comes along?
Yeah, I mean, it's striking that balance between getting the vaccine out but making sure it's safe, and so that's something that we're going to need to balance, and hopefully there'll be data that will support the rollout of vaccines.
And you're currently working on a COVID study, is that correct?
Yeah, so we're going back to what we discussed about the after effects of the COVID-19 infection. And so we're involved in a study where we're actually organ mapping using MRI patients that have had COVID to try and measure and assess the extent of organ damage that patients are experiencing. And what we're finding, initial results suggest that up to 35% of patients that we can see on the MRI scan evidence of damage to the heart muscle. 15% we can see evidence of damage to the kidneys. In 10% we can see evidence of damage to the liver. So it goes back to my point that it is a serious condition, and it's not just the impact of the actual acute infection, but also the ongoing after effects. So this long COVID, as it's referred to. In our trial, I see the patients coming in and I listen to their stories, and it really is affecting teachers, doctors, it's policemen, it's all walks of life. No
Yeah.
one is immune from the impact of this condition. When I hear that, even amongst the medical profession, that 30% of patients or 30% of medics that have been infected are having to take extra time off just to recover after having had the illness. And I know that medics are often, one of the people that are keenest to return back to work and, serve their patients. That just tells me the impact that this is having. I mean, the pressure on the NHS has been immense, and it's amazing the work that has been done by all of the professions across the NHS to help the country through this time.